In general, I always talk to them about the importance of humanizing patient care. But what about the healthcare workers who spend most of their time caring for others? But who takes care of them? Numerous studies have warned about the fatigue and burnout of healthcare workers. And these last 3 years have exacerbated those effects. They received a lot of applause during the pandemic, but not much has been done to improve their quality of life. And if those they treat don't feel well, how can we ask them to treat patients well? Clearly, they are highly skilled professionals who have shown incredible resilience and dedication. But even superheroes need their spaces to recharge their batteries. Even Superman had his place to recharge his batteries in the famous Fortress of Solitude. And that's why today I want to talk to you about recharging rooms for healthcare workers. This is a great humanization strategy, as well as being very easy to implement and having a very positive impact on healthcare personnel. My name is Albert Cervera, CEO of Simbiotia, and I specialize in the humanization of healthcare environments. Join me. You have to put yourself in the shoes of the healthcare staff to know the wear and tear they live in their day-to-day. Long working days in which it is difficult to find moments of relaxation. Cases with complex patients and difficult situations. Rotating shifts, physically or mentally demanding tasks, the impact of seeing people suffering. And let's not forget that they work in an environment that is generally stressful. Hospitals are noisy places which generates a lot of stress, from alarms going off, noise of machines, noise of stretchers walking, doors slamming, people talking loudly, and so on. And garish white lighting that totally throws your heart rate out of whack. It is not surprising that with all this, they have a high risk of suffering physical and mental health problems, such as anxiety and depression. And if we add to this the fact that they generally put the patient's well-being before their own, we arrive at a situation with totally exhausted healthcare personnel and, why not say it, very burned out. The creation of a recharge room is one of the ways in which a hospital can address staff burnout. These spaces allow staff to relax, unwind and escape, if only for a few minutes from their day, and help them to reduce their stress level. They are specially designed to offer hospital staff a place to resume their activities, relax and regain an optimal state of mind, allowing them to continue caring for their patients, especially when they have had a patient or a complicated situation, which is not infrequent. They are not simply rest rooms, they are much more. They are rooms designed using neuroscience research to address anxiety, stress and cognitive performance. There are a variety of situations that require, especially these rooms, to recharge. After giving difficult news to a patient, if they had an interaction with a patient that was complex at the end of their shift or before going home to their family. Sometimes it's just having a quiet space to be able to grieve. This was commented by a nurse when asked what she needed and commented, "I just need a quiet space to cry and prepare to care for the rest of my patients." The recharge rooms are a very quiet room. There is no equipment, no medical equipment inside. There are no beeps, no computers, no patient records, just serenity accompanied by comforting sounds. Nature is a very important axis in our work, of trying to emulate that nature through biophilic design. But how do we bring natural environments into charging rooms? This can be done with plants, both natural and artificial, projecting images of nature on a screen, even going one step further by generating an immersive environment, and an easier way too, thanks to photographs applied as a mural, like the ones we did in this charging room. The screens can be projected from fires, waterfalls, water scenes, tranquil scenes, etc. For these spaces, we create auditory experiences based on clinical research that has shown, among other things, improvements in stress reduction. Through the use of specific tempos, timbres of music, and intervals of music that reduce stress rather than increase arousal, as well as the use of strategically chosen nature sounds that are appropriate for different types of symptomatologies. The introduction of aromatherapy combining different aromas that replicate nature and have been shown to have specific therapeutic effects. And as I was saying, a very important part is to create a dim lighting that will help to reduce the stress of the white lights in the hospital, which honestly is impossible to be relaxed with the light that is in environments such as hospitals. Heavy blankets look silly but have a very relaxing effect. Also have snacks and drinks to revitalize yourself. I was very surprised by a study that showed that most hospital staff had high levels of dehydration. So it is important that they have waters, some healthy food, herbal tea, even chocolatey too. At the air level, it is good to generate ventilation or introduce air purifiers that generated this feeling of fresh cleanliness. Seating is also very important. I recommend the installation of seats, especially that they are comfortable, obviously. They can have different posture options. You can even add options of armchairs that have this massage effect both for the back and for the feet. Another element that can be used are white noise machines. These are small devices that cancel out ambient noise, such as air conditioning or hospital machines, emitting another soft but continuous sound that is always kept at the same frequency. Several studies have been carried out to demonstrate the benefits of these charging rooms, among which there are the most important, the reduction of stress. A study conducted at Mount Sinai Hospital in New York showed that just 15 minutes in the room resulted in an average stress reduction of 60%, which is no small amount. A reduction in exhaustion, improved mental health, and improved productivity. As is obvious, all of this leads to improved patient care due to increased cognitive alertness. And a very relevant point, it improves organizational well-being. And what does this mean? The staff perceives that the hospital is doing something for them, that the organization is really starting to say, we hear you and we feel for what you are going through, and we are going to make things better for you. One nurse who used this room as a tech stop when she finished her shift before going home, and her daughter commented and literally said to her, "Mom, you are so much happier when you get home since this room has been installed." There are multiple ways to design a recharge room, but as I always recommend, it's important to ask and consult with all staff about their needs to create a space that fits specifically to what they need. They can be made from individual rooms, or they can also be used where there are several people at once. If you decide to have several people in the room, it is important to have the possibility of making the spaces private, which can be done in a simple way, such as through some simple curtains. It is interesting to ask the staff if they would like a space to sit, or if they would also like to practice some type of exercise, such as yoga or meditation on the floor. In my experience, there are a few key factors that make or break a project like this. For it to work, it must be easily accessible. The room must be strategically located to facilitate access and visually guide them there. This requires good signage. I have come across hospitals where they have a nice space that most hospitals have no idea even exists. It has to be far enough from your unit to prevent people from your group from entering and interrupting you in this process, thus encouraging its use. Its use requires a mindset change across the organization, because staff need to feel supported in leaving their workstations to take this short break and not have that fear of feeling like you're skipping out, and co-create it with the staff. As I always say, don't take anything for granted, and take the time to have good working sessions with them to get an in-depth understanding of what would work for them. From the insights that are gleaned, staff feel listened to and cared. The dignity of the staff experience matters as much as the patient experience. Recent research makes this clear. Healthy, happy caregivers provide better patient care. I can assure you that caregivers face unimaginable challenges day in and day out. But with every smile they light up, with every word of encouragement they offer, they are making a mark on the world. They are our silent heroes, and now it is our turn to give them the support they deserve. I invite you to join this movement, share this cause, spread the message, and support the creation of recharge rooms. For hospital healthcare workers, let's make every corner of these healing centers shine with the love and gratitude they deserve. Together, let's make a difference in the lives of those who care for us. Give me a like if you liked the video, subscribe and hit the little bell so you don't miss the next videos. Have a nice day.